Hi all, this is Priyadarshini, tutor from SNS College of Physiotherapy. Welcome back to my video. In this video, we are going to see about the skin flap, which comes under the subject General Medicine, General Surgery, Pediatrics and Geriatrics under the subtopic or subsubject General Surgery. So before getting into the topic, in this video, we are going to see just an overview or the outline of skin flap. So now let us get into the topic. Skin flap. A flap is a unit of tissue which transferred from one side to another side while maintaining its own blood supply. The flaps may include skin, fat, fascia, muscle, or bone. So the difference between skin flap and skin graft is that in grafting, the blood supply won't maintain its own blood supply. In skin flapping, the transferred area or transferred site it will maintain its own blood supply itself. Classification of flaps. The skin flaps are classified based on three categories as uh, 8, 9 subcategories also. So let us see what is what one by one. So flaps. Why flaps are preferred and for what are the conditions the flaps are referred as? Why it is not preferred for grafting, only for flap? Let us see detailing about this. Flaps are preferred for exposed bone or tendon or joint conditions like trauma. During trauma, if the bone or tendon or joint got exposed, skin flaps are the only management. Poor vascular wound bed and deep wounds, infected or chronic wounds, pressure areas requiring padding can undergo the procedure of skin flap. Again, the types, it is classified into several types based on the anatomical classification. It is local flap and regional flap. The local flap is again categorized into three types: rotational flap, advanced flap, and transportation. So indications of wounds in general indications of flaps in general are as follows: deep wounds, exposed tendon, as I said before, exposed bone, poor vascular area, breast reconstruction, head and neck defects. Contraindications include poor vascularity, infection, medically unfit patients. Complications like flap necrosis and venous congestion, infection, wound descents, and edema. Physiotherapy management after the skin flap surgery. We have to set the goals as I said previous video. So the goal of physiotherapy is to protect the flap circulation, to prevent edema, to maintain mobility, to prevent contracture. Why we have to prevent edema or maintain mobility or to prevent the contracture? As a physiotherapist, we have to do these goals. Managements like we can give the proper positioning, avoid pressure over the flap, and we can give the gentle range of motion exercises, breathing exercises if trunk is involved in the process of skin flapping. Scar massage is also one of the main management of the flapping technique. Functional retaining. Yes, obviously the patient undergoes surgeries should retain their functional activities of daily living without any support or without any dependent. So we have to, as a physiotherapist, we have to train them for their functional activities of daily living. So as a whole summary, the skin flap is a transfer of skin and underlying tissues from one area to another while maintaining its own blood supply. The important keyword is the own blood supply. It is used for deep wounds, burns, ulcers, exposed bones, tendons, or reconstructive surgeries like breast reconstruction. And types include random pattern, axial pattern, local, regional, and flea. So random pattern flap, no named blood vessels. Axial pattern flap has named blood vessels and local regional free based on the movement it is classified. So advantages, better survival in poorly vascularized areas. It covers complex defects, faster healing than graft in deep wounds. Complications include flap necrosis, infection, edema, venous congestion. And the physiotherapy role, as I said, positioning, edema, control, and range of motion exercise, scar massage, and functional rehabilitation. Thank you.